What are the symptoms of atrial fibrillation? Well, think about it. Atrial fibrillation is an abnormal source of electricity that is formed inside the walls of your heart that is randomly waking up, sending out electricity at a much faster speed than the normal source of electricity that normally tells your heart what speed to beat at, which is controlled by your brain. That's why your heart doesn't go at an abnormally fast speed when you're in normal rhythm. And when you have this abnormal rhythm of AFib wake up, override your normal source and take over control, it can make your heart go fast. And it's the speed that primarily causes the symptoms of atrial fibrillation. So somebody wanted to know what symptoms they might have in atrial fibrillation. The question becomes, well, what symptoms might you have if you were exercising hard on a treadmill in your normal rhythm? So let's say you get on a treadmill and you start pushing yourself really hard, you're exercising really hard, and you're in your normal rhythm, and your brain speeds up your heart rate with exercise, which is appropriate. And now your heart rates are 110, 120, 130 beats per minute because you're exercising. What might you feel? Well, you could feel palpitations, you could feel your heart racing, you could feel short of breath, tired, a little bit of chest discomfort, maybe even a little bit of lightheadedness. Well, those are the same kinds of symptoms that you would get in an abnormal heart rhythm like atrial fibrillation. There is no difference between an abnormal rhythm making your heart go fast versus your normal rhythm making your heart go fast because you're exercising or there's some good reason why your heart's going fast. Your heart's just going fast. The only difference is the symptoms, because when you're in your normal rhythm, exercising, feeling lousy because you're pushing yourself and your heart rate's fast, you kind of accept that. You say, hey, I'm feeling lousy because I'm exercising and my heart's going super fast, but that's just because of the exercise. If I were to stop and relax and rest, I know that my heart rhythm speed is going to come down and then I'll feel more normal. But when you're in an abnormal heart rhythm like atrial fibrillation, you have no control over these abnormal cells. They've woken up, nobody controls them, they're telling your heart to speed up, and nothing you do is going to make them necessarily slow down or stop or go back to sleep. You have no control over that. And so that's the big difference. And so therefore, the symptoms of atrial fibrillation are really from the rapid heart rate, but they're really no different than if you were exercising. You may not be physically exercising, but your heart is racing like it's exercising, and that's where the symptoms come from.